When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB. Good, useful, and full of wonder.
Good morning. We now have a quorum. We'll call the Senate Health and Human Services Committee meeting to order. I'd like to welcome everybody. It's listening online, everybody in the room, and anybody that might be watching on the streaming service. I want to remind everybody to turn your cell phones to silent, like I didn't do yesterday. And with that, I'd ask the Secretary to call the roll.
Senator Grove.
Here.
Perry.
Here.
Reed, excused. Smith, excused. Voigt.
Here.
Davis, excused. Jensen.
Here.
Mr. Chair, we have a quorum.
Okay, thank you. I'd like to remind everybody that if you're going to testify, please sign in on the iPad, and if you're testifying on your own behalf, please, when you come up, introduce and tell us that you're introduced, or that you're testifying on your own behalf, and that and the lobbyists, of course, you know the drill. Have your proper credentials or your proper tags on. So, with that, I'd ask for a motion to approve the minutes from the previous meeting. Senator Perry moves, seconded by Senator Grove. All those in favor say aye. Aye. Opposed, nay. Okay, thank you. Minutes are approved. So we have both our pages. If we could have you come up and introduce yourself and where you're from, and if you have plans for after school.
My name's Claire Cordell. I'm from Gettysburg, and after school I plan on either going to Mount Marty or USF and double majoring in theology or psychology or sociology.
My name is Levi Atkins. I'm from Willow Lake, South Dakota, and after school I plan to go up to Northern and major in elementary education.
Very good. Thank you, guys. And as a reminder, if you have any handouts for the committee, please give those to the pages, and then we'll distribute those. Do you have any special privileges from the committee at all? Okay, so we are going to have a little change of the agenda here. We're going to take House Bill 1105 first, and House Bill 1105, restrict contracts and declarations that prohibit the use of commercial or residential property for any healthcare service in medically underserved areas or communities or in areas with a medically underserved population under federal law. Do we have any proponent testimony? That's probably the longest bill title of the year.
Good morning, Mr. Chair and Committee. Marty Overweg, Representative District 21. You've all been around here long enough to know that things change in Pierre a lot, about like the weather, so I guess if you would do me the favor, and would you please table this bill?
So moved.
Senator Smith moves to table House Bill 1105, seconded by Senator Perry. Non-debatable motion, so we'll just ask the committee to call the roll. Or the secretary, I'm sorry.
Senator Grove.
Aye.
Perry.
Aye.
Reed, excused. Smith.
Aye.
Voigt.
Aye.
Davis, excused. Jensen.
Aye.
Mr. Chair, we have 5 yeas and 2 excused.
Okay, thank you. At the request of the prime sponsor, House Bill 1105 has been tabled. Thank you. So next up, we will take House Bill 1099. Reschedule the pharmaceutical composition of crystalline polymorph psilocybin and a drug product approved by the Food and Drug Administration as a Schedule 4 controlled substance. Do you have any proponent testimony?
Good morning, Mr. Chair and members of the committee. My name is Senator Tom Pischke, and come before you today with House Bill 1099. Forgot to say I'm from District 25 and the best municipality in the state, Del Rapids. Oh, okay, just making sure. I appreciate the opportunity to present House Bill 1099 today. I bring forward this bill on behalf of the residents of South Dakota who need timely access to innovative new treatments that are FDA approved for mental health conditions. The purpose of House Bill 1099 is to address bureaucratic delays that prevent South Dakotans from accessing newly approved innovative treatments. When the Food and Drug Administration approves a new treatment that is classified as a Schedule 1, the Federal Drug Enforcement Administration, the DEA, will make a rescheduling decision for the treatment, moving it from a Schedule 1 to a lower schedule. This essentially provides for the legal use of the medical treatment in the United States. However, at the state level, certain processes must also take place to allow patients in South Dakota to be prescribed and to access new and innovative treatments. In South Dakota, legislation must be passed to reschedule a substance on the controlled substance list. Acting now by passing this legislation is more urgent than ever, as so many South Dakotans struggle with serious mental health conditions such as treatment-resistant depression and post-traumatic stress disorder. Time and time again, patients can be failed by medications currently on the market, meaning they need rapid access to new options as soon as they become approved by the federal government. Recently, Compass Pathways reported encouraging findings from its second phase 3 study of COMP 360, showing another robust and statistically significant improvement in depressive symptoms among people living with treatment-resistant depression. These new results further demonstrate the promise of this emerging class of therapies and reinforce the importance of passing HB 1099. Now, to ensure patients can benefit without unnecessary delays if an FDA-approved option becomes available. Certain psychedelic compounds, such as synthetic psilocybin, are currently in the phase 3 clinical trials and have received breakthrough therapy designation. However, this substance remains a Schedule I drug, defined as having no medical use. Once the FDA approves the formulation of synthetic psilocybin, then the DEA will take action. But again, the state must take action before it's accessible to patients here. So HB 1099 streamlines this process by rescheduling the FDA-approved pharmaceutical composition of synthetic psilocybin as a Schedule IV controlled substance. This bill eliminates unnecessary delays in patient access to innovative treatments and ensures South Dakotans access those treatments. I respectfully ask for your support on House Bill 1099. Thank you, Mr. Chair.
Thank you. Do you have any other proponent testimony? Good morning.
Morning. Alex Root with Compass Pathways. Chairman Jensen, members of the committee, thank you for taking the time to consider HB 1099. My name is Alex Root. I'm the Senior Manager of Government Affairs for Compass Pathways, and here in support of the bill today. HB 1099 is an important bill to ensure South Dakotans have access to mental health treatments in a timely manner. HB 1099 would reschedule an FDA-approved pharmaceutical composition of crystalline polymorph psilocybin as a Schedule IV controlled substance. As you know, mental health remains a significant issue in the United States, with 1 in 5 adults experiencing a mental health condition each year. Amidst this crisis, the need for novel treatments to help patients is significant. Yet, new treatments have not kept pace with the growing crisis. We've experienced a lack of innovation for mental health therapies for decades. Psilocybin is currently a Schedule I drug both federally and in South Dakota, meaning it is considered an illegal substance with no medical use. However, pharmaceutical-grade formulations of synthetic psilocybin are currently being studied in FDA-regulated clinical trials for mental health conditions, including treatment-resistant depression and post-traumatic stress disorder. Importantly, Compass Pathways recently announced positive results from its second phase 3 trial of COMP360, once again demonstrating a highly statistically significant and clinically meaningful reduction in depressive symptoms for patients with treatment-resistant depression. This new data underscores the real potential of psilocybin therapies and highlights why preparing now through HB 1099 is so important for timely patient access. Treatment-resistant depression occurs when a patient suffering with a major depressive disorder is failed by 2 or more medications in a single depressive episode, and occurs in approximately 1/3 of patients being treated for major depressive disorder. In the event that a prescription drug containing crystalline polymorph psilocybin, such as Compass's COMP360, is approved by the FDA, the United States Drug Enforcement Administration will be expected to make a rescheduling decision soon after approval, allowing for prescription medical use of the FDA-approved product in the United States. As South Dakota law does not allow for automatic following of the DEA's rescheduling decision, it is imperative that legislation be passed in anticipation of a potential FDA approval of a new and innovative treatment, such as COMP360. Doing so will allow patients in your state with treatment-resistant depression to have access to this potential new treatment if approved by the FDA as quickly as possible after approval and DEA rescheduling. If the FDA does not approve a crystalline polymorph psilocybin product, then nothing happens in South Dakota. This bill does not decriminalize or legalize psilocybin, nor does this bill allow access to medications that have not been approved by the United States Food and Drug Administration. Rather, it provides hope of timely access to innovative treatments for those suffering from mental health conditions, provided those treatments have been approved by the FDA and rescheduled by the DEA. In short, this bill helps accelerate access for patients to a potentially FDA-approved and innovative mental health treatment. Unless and until an FDA-approved and DEA rescheduled crystalline polymorph psilocybin product is also rescheduled in South Dakota, patients will not have access to it. Thank you for your time, and I ask that you please vote yes on this bill.
Okay, thank you. Do we have any other proponent testimony? I think we have online. Mr. Davidson, are you online at the moment?
Yes, Chair, I am.
Okay, go ahead and introduce yourself and begin your testimony.
Thank you. My name is Logan Davidson, and I am the Legislative Director for VETS, Veterans Exploring Treatment Solutions. We are a nonprofit organization dedicated to expanding access to therapies for veterans with TBI, PTSD, and other mental health challenges. I am here today in support of HB 1099. Veterans are one of the most vulnerable populations when it comes to mental health. Since 2001, over 125,000 veterans have died by suicide, and 29% of global war on terrorism veterans are known to suffer from post-traumatic stress disorder. The disproportionate incidence of PTSD among veterans is also a driver of the disproportionate incidence of suicide among them. According to the U.S. Department of Veterans Affairs, there were 18 veteran suicides in South Dakota in 2022. that is a significantly higher suicide rate than the national general population. Current mental health treatment options available to our veterans through VA healthcare facilities have been far from universally effective. Our veterans and their families need access to alternative therapies that address the complexity of the challenges they face following service to our nation. As demonstrated by ongoing medical and scientific research, psychedelic therapies are rapidly emerging as an effective tool in treating PTSD, traumatic brain injury, treatment-resistant depression, substance use disorder, and other mental health indications that fuel disproportionate rates of suicide among the veteran population. All psychedelics, including psilocybin, are currently Schedule I substances under the Federal Controlled Substances Act. Schedule I drugs have no accepted medical use and may not be prescribed, dispensed, or administered in the United States. Upon U.S. Food and Drug Administration approval of a current Schedule I medicine, the DEA will evaluate the newly approved medicine for rescheduling. The U.S. Drug Enforcement Administration will review relevant data provided by the company during the new drug application submission and perform an 8-factor analysis to assess the abuse potential of the newly approved medicine. The DEA will then make a federal rescheduling decision. States will then need to update their own state CSAs and regulations to allow for the medicine to be prescribed to patients in their state. This is where HB 1099 comes in. HB 1099 would reschedule an FDA-approved pharmaceutical composition of crystalline polymorph psilocybin as a Schedule IV controlled substance. Our goal should be to get therapies to patients who need them as quickly as possible. Enacting a law that would automatically reschedule a medication once the medication has been rescheduled by the DEA is one of the most important steps you can take to achieve the goal of timely access. We want to make sure veterans in South Dakota aren't left behind due to delays in administrative or legislative requirements. I ask you to vote yes on HB 1099 to ensure that veterans are able to access the care they need in a timely manner. Thank you so much, and I'm happy to answer any questions.
Okay, thank you very much. I think we have also online Lisa Brown. Are you online right now? If you want to go ahead and introduce yourself and begin your testimony.
Sure. I'm Dr. Lisa Brown. I'm a family medicine physician out in Custer, South Dakota, and I'm speaking obviously in support of this and on behalf of myself. I've spent 20 plus years practicing family medicine and have seen in the clinic, ER, hospital setting, patients with tragic situations, and some less, but still very impactful for job loss, loss of relationships, for people who just do not have adequate response to usual treatments. So in about 2016, I started following the research on psychedelics for mental health, have spent the last 2.5 years gaining training, and am looking forward to having agents to work with. Medicines and psilocybin coming down through an FDA pathway would make that available to me to work with in a medical setting for patients who, again, don't respond to usual treatment. I've been caring for patients with ketamine for the last year or so, and really looking forward to this. I see this as a preparatory step by the state so that, again, as has been spoken to, as soon as it's available through the FDA and DEA rescheduling, that appropriately trained prescribers, and ideally in collaboration with therapists, can move into using this for the care of patients as quickly as possible. And I'm available to offer or to answer any questions about how this might be used in practice. Thanks.
Okay, thank you. Any other proponent testimony? Good morning.
Good morning, Mr. Chairman, members of the committee. My name is Justin Bell. I'm an attorney from Fort Pierre, and I'm a registered lobbyist for Compass Pathways. I just want to discuss a little bit of the history regarding this legislation and some other legislation we've had similar to this in the past. First, the idea of what House Bill 1099 is doing is not new in South Dakota. The last time that we or this body, rescheduled something in advance of FDA approval was in 2017. At that time, this body passed Senate Bill 95, which pre-scheduled Epidiolex, which was a CBD-based treatment for treatment-resistant epilepsy upon FDA approval, just like what we're doing as relates to this. Thereafter, Epidiolex received FDA approval. In fact, if you look at our current law, there are several exemptions in Schedule I for an FDA-approved medicine. The bill in front of you is pretty long. It's like 15 pages, but we're only adding about 2 sentences in it. But if you look at that bill, you can see the current law. And in that, you can see that there's an exemption on page 2, line 9, for an FDA-approved product on page 3, line 9, on page 4, line 25, page 10, line 9, and page 11, line 14. I would bring that up to show or state that this is not an uncommon situation where we do something like this. Likewise, South Dakota isn't breaking new ground with this legislation. As an example, both North Dakota and Nebraska passed similar legislation for FDA-approved psilocybin in their annual controlled substances update legislation last year. So this is not something that's only happening in South Dakota. In short, this is good legislation with precedent in South Dakota and elsewhere, which we believe will help South Dakotans have access to medicine for depression as soon as possible. In addition, the potential for such treatments has been touted by both Health and Human Services Secretary Kennedy at the federal level and VA Secretary Doug Collins at the federal level. With that, we thank you for your time and would encourage you to send this to the floor with the do pass recommendation. Thank you.
And thank you. Do we have any other proponent testimony? Is there any other proponent testimony in the room? Seeing none, do we have any opponent testimony? Okay, nobody coming forward, so no need for rebuttal. Questions from the committee? Nope. Okay. Nope. Okay. So we'll close questioning and move to committee action or discussion.
Mr. Chair,
Senator Perry?
I believe that HB 1099 should be due pass, and I would encourage all of us to go along with that.
Any remarks? Okay, so Senator Perry moves House Bill 1099 do pass, seconded by Senator Smith. Any other comments? Go ahead.
I really appreciate this legislation. I've been following this quite a while. I had a client of mine that was a counselor that dealt with people with severe trauma, and they would often have to go to other places in order to do the treatment necessary for her clients, and it worked. So I'm excited for what this can do for people. Hopefully it lowers suicide rates and things like that. And I'm looking forward to the day that we can help these people that are suffering from this depression. And I do hope that this drug does ease that in many patients.
Okay, thank you. Any other comments from the committee? So Senator Perry moves House Bill 1099 do pass, seconded by Senator Smith. I'll ask all those in favor say aye, opposed nay. I'll ask the Secretary to call the roll.
Senator Grove.
Aye.
Harry.
Aye.
Reed excused. Smith.
Aye.
Voigt.
Aye.
Davis.
Aye.
Jensen.
Aye.
Mr. Chair, we have 6 yeas and 1 excused.
Thank you. House Bill 1099 does move to the floor with a do pass recommendation. Is there any objection to consent? Seeing none, we'll certify House Bill 1099 on consent. Thank you. So moving on, we'll go to House Bill 1162. Add certain substances of Schedule 1 to the Controlled Substances Schedule. Sounds familiar. Do we have any proponent testimony?
Mr. Chair, committee members, my name is Jana Hunt. I'm the representative for District 28A. Thank you for hearing me out. House Bill 1162 is a simple bill. It's requesting that we add tianeptine and phenibut to the Schedule 1 list. Schedule 1 drugs are defined as drugs with no current acceptable medical use and have high potential for abuse or addiction. Neither tianeptine nor phenibut are FDA approved and are both highly addictive. As a matter of fact, the FDA recommends that they do not be used over the counter. Tianeptine has a different name. It's called gas station heroin. It was created in the 1960s in France, and it was created for use as an atypical antidepressant. Unfortunately, it acts like an opioid as it interacts with the opioid receptors in our brain and has led to many deaths since its creation. At least 9 U.S. states have taken legislative action to restrict access to tianeptine and place it on the Schedule 1 list. And the reason I'm bringing you this bill today is because Rapid City independently took action and banned it in its city so that it couldn't be sold in the gas stations. I can go into the adverse side effects, but I'm not going to. They're severe. I'll move on to the Phenibut, which is I'm also requesting we put onto the Schedule 1 list. It was developed in Russia in the 1960s, and it was sold as an atypical antidepressant as well, but now the FDA is labeling it as a research chemical and an unregulated supplement. They did a study between 2009 and 2019 where there were over 1,320 Phenibut exposure calls to the poison control throughout the United States. In that study, they had over 80 cases that reported comas, ended up in a coma, and over 3 deaths. This is a controlled substance that's been banned in many countries in Europe, and the states are beginning to start putting it on the Schedule 1 list. So I would ask for a due pass and recommend that we do this in South Dakota.
Okay, thank you. Any other proponent testimony? Good morning.
Good morning, Mr. Chair, members of the committee. Jenna Severin, South Dakota Police Chiefs Association. We also rise in support of this bill. Really do thank the prime sponsor for bringing this to the legislature's attention. Also thank her for her excellent testimony. I think she took all of the words out of my mouth, especially gas station heroin, which is what our officers are hearing this be referred to here on the streets in South Dakota. And she is correct in that Rapid City did place a citywide ban on the product in 2025. I do just really want to emphasize, I think sometimes people seeking to treat their ailments or their various conditions sometimes mistake a product, especially a new product that's not regulated, that doesn't have a lot of information out there about it, as being safe because it is available, whether that be online, in gas stations, in brick and mortar stores. And that's really what we want to get a jump start on with these two products here in South Dakota. So we would ask for your support in passing this bill. Thank you.
Thank you. Do you have any other proponent testimony? Good morning, Mr. Dash. You haven't been here too many times this year.
Not too many times, Mr. Terry Dash. I'm the Executive Director of the South Dakota Council of Community Behavioral Health. And so we want to stand up on this measure and be recognized as a supporter. As before, we really thank the sponsor for bringing this because it's extremely timely, especially with respect to the tianeptine piece. We hear it referred to oftentimes as the gas station heroin, but also as Pegasus, Jaja, Tiana, Neptune's Fix. In other words, we're starting to see it in South Dakota now. My centers that treat substance abuse are expressing concern about it. It is a dangerous drug, especially when it's used in very high concentrations or very high dosages. It is opioid-like and oftentimes used to replace opioid-type substances. Withdrawal is a major issue with it, and overdose is also a major issue with it. So I'd ask you to support this measure, not so much to criminalize it, but as a really important public health measure. That would be my messaging today. Thank you.
Thank you. Do we have any other proponent testimony? Okay, seeing none. Any opponent testimony? Okay. Seeing nobody coming forward, no need for rebuttal. Any questions from the committee?
Just want to confirm, if you'd help me out, and I apologize for being late. We're on 1162?
Yes.
Okay, thank you.
Okay. Yep. So then I guess we'll close questioning and move to committee action or discussion.
Mr. Chair?
Mr. Chair.
Senator Davis?
I move do pass on HB 1162.
Second.
Okay. So Senator Davis moves House Bill 1162 do pass, seconded by Senator Voigt. Any discussion on the motion?
I think the sponsor and the proponents did a great job explaining how needed this is for public safety and overall health. So, thank you.
Okay, thank you. Any other discussion? Nope. So the motion before us is do pass by Senator Davis on House Bill 1162, seconded by Senator Voigt. Those in favor say aye, opposed nay. I'll ask the secretary to call the roll.
Senator Grove.
Aye.
Perry.
Aye.
Reed.
Aye.
Smith.
Aye.
Voigt.
Aye.
Davis.
Aye.
Jensen.
Aye.
Mr. Chair, we have 7 yeas.
Okay, House Bill 1162 passes with due pass motion. Any objection to consent? Okay, we will certify House Bill 1162 for consent. Just note now, another member just showed up. House Bill 1105 was tabled by the sponsor. Just one, and if anybody came late to the meeting online or anything, House Bill 1105 has been tabled. So now we'll move on to 1169. Classify I haven't read this one yet. Medetomidine. I'll let somebody else pronounce that one. As Schedule 3 controlled substance and establish permissible uses. Any proponent testimony?
Good morning, Mr. Chair and Senate Committee. My name is Tamara Grove, District 26 Senator. I only came up here so I could try to say the word, and then I'm handing it off to the doctor. An act to classify Tomidine as a Schedule 3 controlled substance and establish permissible uses. I stand by for questions.
Okay, thank you. Any other proponent testimony? Good morning.
Good morning, Mr. Chair and committee and those listening. Representative Garcia, District 5. I bring to you House Bill 1169 to classify medetomidine as a Class 3 controlled substance. Class 3, as you know, is there's a chance for moderate abuse risk. Drugs that are in this category would be like testosterone and ketamine. So we're asking that this be classified as a Schedule 3. Medetomidine is an alpha-2 adrenergic agonist, which is approved for use only in veterinarian medicine. Xylazine is the equivalent. The mechanism of action of this drug is it acts like a brake on the sympathetic nervous system. So it decreases or inhibits your norepinephrine release and causes heavy sedation. It works by slowing your heart rate close to zero, causing hypotension and a deep sleep, which we cannot reverse with naloxone or Narcan. It takes away pain, and obviously you have a lack of flow to your tissues, oxygen flow to your tissues. Having said that, this drug is being used to add to the effects of fentanyl and other drugs it mixes with. Because there's a fentanyl potency is dropping, as well as the xylazine supplies is dropping, we now have found that the medetomidine is being replaced with these chemicals and being abused, causing heavy sedation and abuse of IV drug users. So we're asking that this be classified as a Class 3 scheduled controlled substance. It's 200 times more potent than xylazine, just for your facts there. So I ask for your support in this, and thank you. I'll stand by for questions.
Thank you. Any other proponent testimony? Good morning.
Good morning, Mr. Chairman, members of the committee. I come with a little bit different hat. I'm here on behalf of the South Dakota Veterinary Medical Association, and we do support House Bill 1169 and appreciate the sponsor's allowance for veterinary medical use in the bill. That's very important. So I won't get into the very technical terms of it, but 2 years ago, you scheduled xylazine with the same language that's in 1169. Xylazine is essentially the large animal sedation tool that we have for veterinarians. Medetomidine, the sedation drug in this bill, is what we use for small animals. And so it's very important. We certainly share the same concerns of the prime sponsor that this is now becoming, unfortunately, a drug of choice to lace in fentanyl, but it is a critical component of veterinary medicine. And so we do need the language in the bill as it is to make sure that veterinarians have access to it.
Thank you. Any other proponent testimony? We have none online. So moving on to any opponent testimony. Okay, seeing none. No need for rebuttal. I do have a question, though, maybe for Dr. Garcia. So as a Schedule 3, is there any human use for this as a Schedule 3 could be prescribed by a doctor?
You know, it's a great, Senator, I'm sorry, Mr. Chair. Yes, we do use it similarly when you intubate patients. Yes.
Okay, thank you. Any other questions from the committee? Okay, seeing none, I guess we'll close questioning, move it to committee action and/or discussion. Senator Perry.
I will move due pass on House Bill 1169.
Second.
So Senator Perry moves due pass on House Bill 1169, seconded by Senator Davis. Any comments on your motion?
I think whenever we have people that are expert in the industry giving us suggestions that make sense for controlled substances and established uses. I think that we should follow their advice.
Okay, thank you. Any other comments? Seeing none, so the motion before us is House Bill 11, do pass on House Bill 1169 by Senator Perry, seconded by Senator Davis. All those in favor say aye, opposed nay. House Secretary, please call the roll.
Senator Grove.
Aye.
Perry.
Aye.
Reed.
Aye.
Smith.
Aye.
Voigt.
Aye.
Davis.
Aye.
Jensen.
Aye.
Mr. Chair, we have 7 yeas.
Okay, thank you. So House Bill 1169 would pass to the floor with a do pass motion. Any objection to consent on this bill? Seeing none, we'll certify House Bill 1169 for consent. So before we adjourn, I just want to remind everybody that we have a pretty tough bill log for next. I should have scheduled some more bills today. I didn't know we were going to have a talker tabled. So if you've noticed in the agenda, we'll have 2 meetings on Monday, a morning meeting and then an afternoon meeting after session. And just wanted everybody to make sure you're aware of that. So, and there was a request from Representative Kaiser on a video. I would encourage everybody to try and watch that video because we're not going to see that video in committee next week. So if you could watch it ahead of time so everybody knows what we're talking about, appreciate that. So, pardon me?
Has the link been distributed?
I will make sure Representative Kaiser sends it.
Make sure it's uploaded then.
Okay, it's already uploaded on.
No, it's not.
Oh, it's not.
I will make sure it is.
We'll make sure it's, yeah, okay.
Okay.
Just to make sure, because, yeah, we have, we're kind of on the Senate side, trying to reduce the number of videos being played in testimony. So with that, I'd ask for a motion to adjourn.
So moved. Second.
Senator Perry moves to adjourn, seconded by Senator Smith. All those in favor say aye.
Aye.
Opposed, nay. We are adjourned. Thank you.
From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts Programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota legislature and in-depth reporting from Pierre. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB. Good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota Legislature and in-depth reporting from Pierre. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB.
Are we early?
No, not early. I'll call Senate Local Government to order right on time. And let's see. I want to welcome everybody, greet the listeners on the internet. And just a reminder for everybody, please turn off your cell phones or turn them to silent. And I'll ask the secretary to please call the roll.
Senators Nelson. Here. Roll.
Here.
Shanefish.
Here.
Smith. Here. Whiff.
Here.
Duhamel.
Here.
Reed.
Here.
Mr. Chair, we do have a quorum.
Thank you, Madam Secretary. I'll entertain a motion to approve the minutes of our last meeting.
So moved.
We have a motion by Senator Duhamel, a second by Senator Nelson. Comments on your motion? Seeing none, all those in favor of approval of the minutes will say aye.
Aye.
Opposed? The minutes are passed. So, I'd like to remind all the testifiers to sign in. We've got a new electronic system if you haven't done it yet this year. So make sure that you are signed in. If you're lobbyists, please be wearing your badges. I'd like to remind the testifiers that all handouts are to be distributed by the pages, and we'll ask that the pages come up and introduce themselves and tell us a little bit about yourselves.
Good morning. I'm Ryler Stivix. I am a senior at Gregory High School. With this being Senate local government, that's a little bit special to me as I attend many of my local school board and city council meetings.
Good for you. That's awesome.
Hello, my name is Poppy Stevens. I'm from Rapid City and I'm a junior at Central High School. And I actually don't know much about local government, so I'm excited to listen and see what this meeting is about.
Good to have you both. Thank you. Any personal privileges from members? I'd just like to remind everyone that all testimony and all questions will be addressed through the chair. So we'll go ahead. We're going to take our schedule as the agenda is listed, and we're going to start with House Bill 1092. This is an act to update provisions pertaining to open records, and I'll call for proponent testimony. Welcome, Representative.
Thank you, Mr. Chair. Mary Fitzgerald, District 31, Lawrence County. House Bill 1092 is a bill to align language in the open records laws with similar language found in our open meetings laws. In 2022, the legislature unanimously approved House Bill 1087, which amended the open meetings laws. Specifically, the bill changed one word in SDCL 127.1.5. It changed it from including to specific to. This was in response to a 2020 decision made by the Open Meetings Commission involving an executive session held by the Belle Fourche City Council. However, at that time, the identical language that exists in our open meetings or our open record statutes was not updated. House Bill 1092 provides that fix today. If you will look on page 2, line 16 of the bill, you will find the change that mirrors the change made to the open meetings laws in 2022. That is basically it. I would ask your favorable consideration. I'll stand by for questions. Thank you.
Thank you, Representative. Further proponent testimony. Proponent testimony for House Bill 1092. And we do not have any online testimony, and so I'll go to opponent testimony. Is there any opponent testimony for House Bill 1092? Opponent testimony. See none, I'll rebuttal and go on to questions. Does any committee member have a question?
Mr. Chair.
Senator.
Thank you. Since you're here, would you mind just explaining to us with the specifics? Remind us of what this case was, but it seems like an obvious change to get in line with our open meetings laws and this similar language.
Yes, Mary Fitzgerald, District 31. Well, it was, as a result of a decision made by a Open Meetings Commission decision involving an executive session held by the Belle Fourche City Council. So I'm not really privy to what went on in that executive session. However, they did change that, including to specific to, and just never updated the statute. So that's why I'm here today. Thank you.
You know what? I'm going to allow if you want to come up and be a proponent. State your name.
Good morning, Mr. Chairman, members of the committee. Justin Smith, attorney from Sioux Falls. I apologize greatly for my tardiness. I have 3 different bills up in multiple different committees and was confused on the room. So we, as the New South Dakota News Media Association, support this bill. We appreciate Representative Fitzgerald bringing it. It is a very small surgical change to the law to make it consistent with the 2022 legislation, House Bill 1087. And for all the reasons that I'm confident she stated in favor of the bill, we'd ask your support. Thank you.
Thank you. Okay, we'll come back to questions. Are there any questions from members? Seeing none, we'll move on to action, discussion and/or action on House Bill 1092.
Mr. Chair.
Senator.
I move do pass.
Second.
We have a do pass motion on House Bill 1092 made by Senator Whiff, second by Senator Duhamel. Comments on your motion?
No.
Specifically?
Does anybody else have comments? The case actually was they went in executive session on an HVAC system that they were thinking about replacing that caused all this. And I worked on some of this, and thank you for correcting something I didn't get done, so I appreciate that. So with that, we have a do pass motion made by Senator Whiff, seconded by Senator Duhamel on House Bill 1092. That's a do pass motion. All those in favor will say aye. Those opposed say nay. Madam Secretary, please call the roll.
Senators Nelson? Yes. Roll?
Aye.
Shanefish?
Aye.
Smith. Whiff.
I vote in the affirmative.
Duhamel.
Aye.
Reed.
Aye.
Mr. Chair, we have all yeas.
House Bill 1092 will go to the floor with a do pass motion, and I will certify that on consent unless there's an objection. Seeing none, House Bill 1092 will go on consent. We will now move on to House Bill 1106. This is an act to revise the terms of County Extension Board members, and I'll ask for proponent testimony. Proponent testimony. Do you just want to start off and then? Yeah.
Good morning, Mr. Chair and Committee. Marty Overweg, District 21 Representative. Give me 1 second to catch up here a minute. I didn't think I was starting. Bringing you House Bill 1106. This bill came out of some county commissioners that I know that come up with this problem, that when we're talking about this certain board, and this was the only board, the extension board, that everyone had to serve a 1 year, and then every year that when they organized at the beginning of the year, they had to reorganize this board. And some of the counties have had trouble with everyone quitting at the same time, so they had a brand new board, so nobody had any experience. So what they'd like to do is bring this in. This is right out of Brookings County, Mr. Chair, so this is your home. But they'd like to do is be able to have the option to stay at 1 year. If any county wants to, this will not change anything they do, but gives them the option to get staggered years, so people will have some clarity when they're coming back, and the new people can learn with them, and it just gives the counties more options. And I guess that's about what I know about this. So I would appreciate your green vote. I think it's a good bill.
Thank you, Representative. Further proponent testimony? Proponent testimony.
Good morning, Mr. Chair, members of the committee. Eric Erickson with the County Commissioners Association. We appreciate the sponsor bringing this issue to us. I have reviewed it and support it and would ask for your favorable consideration.
Thank you. Further proponent testimony? Proponent testimony. We're on proponent testimony for House Bill 1106. Welcome, Senator.
Good morning, members of the committee. Senator Michaela Voida, District 21. I'm here to stand in support of this bill. I just hope that the committee will help us to make government better and more efficient. Thank you.
Thank you. For the proponent testimony, House Bill 1106. Seeing none, we'll go to opponent testimony. Is there any opponent testimony for House Bill 1106? Seeing none, I'll waive rebuttal and go into committee questions. Are there any questions from the committee members? Seeing none, I'll move on to discussion and/or action.
Mr. Chair.
Senator Shanefish.
I'll move to pass. Second.
We have a do pass motion on House Bill 1106 made by Senator Shanefish, seconded by Senator Whiff. Comments on your motion?
I got so used to saying no yesterday on the floor, I'll just say no to comments again. But
we're kind of a loose committee today.
I know.
Any other comments on the do pass motion? Seeing none. Those in favor of the do pass motion on House Bill 1106 will say aye. Opposed, nay. Madam Secretary, please call the roll.
Senators Nelson.
Aye.
Roll.
Aye.
Shanefish.
Aye.
Smith. Whiff.
Aye.
Duhamel.
Aye.
Reed.
Aye.
Mr. Chair, we have all yeas.
Thank you, Madam Secretary. House Bill 1106 with unanimous approval for a do pass will go to the floor, and I'm going to certify it consent unless there's an objection. Seeing none. We'll now move on to House Bill 1320. This is an act to revise provision related to service of process for boards of county commissioners. I'll ask for proponent testimony. Welcome, Representative.
Good morning, Mr. Chair and members of the committee.
If you'd go ahead and introduce yourself.
Thank you. I just caught myself. Thank you for reminding me. Representative Tony Randolph, District 35. So what this bill, House Bill 1320 is attempting to do is to make the process easier for the public, citizens, to be able to serve their county commission as far as appealing a ruling of the board. Right now, currently in law, the only way to do that is to serve an actual sitting commissioner, personally. There's no other way to do that. And what this basically does is that opens it up a little bit. So as you can see in the bill, basically it says upon a county administrator, commissioner, executive, treasurer, or any registered agent of the board. Now, some asked why I didn't add an auditor or why I went with treasurer, that sort of stuff. Well, the auditor is kind of part of the process. Someone asked why I didn't say, well, why not? How about the state's attorney? They're the ones that represent. Well, they're part of the process. And I thought, instead of trying to lump and include all of that in, let's just make some specific offices that are there, like the county treasurer is there. That's what they do. They're in their office each day, that sort of thing. Now, the other part I will add, because there was someone that had, and it might be, I don't know if there's an opponent in the room, but part of the conversation had to do with registered agent. And they said, well, counties don't use registered agents. Well, they don't have to use a registered agent just because it's in this bill. But a registered agent is not a part of a county government or any government. It is a private entity that can be used if they so chose. But they are also listed in our statutes as to what registered agents are. So again, the idea is just to make it easier for the public. And maybe I'll add one more thing. One of the questions I had in the House was sheriffs. County sheriffs do this thing as well, right? Why not just simply use them? Well, you can, and they still can be used. At the time, I wasn't sure if a county sheriff would actually be able to, since they're part of the county government, and they actually give reports to the county commission, if that would be, if that's something they would do or could do. But they can do that. But in our laws, you as a citizen can actually go through the process of getting all the legwork done and serving it yourself, I should say. So this just simply makes it that much easier. So I would ask for your favorable vote and stand by for questions. Thank you.
Thank you, Representative. Further proponent testimony on House Bill 1320. Proponent testimony. Seeing none, opponent testimony. Is there any opponent testimony for House Bill 1320? Welcome. If you'd please introduce yourself.
Good morning, Mr. Chair and committee members. My name is Holly Hennies. I serve as the Deputy Director for the South Dakota Association of County Commissioners. We are here today with soft opposition to House Bill 1320. First off, I do want to say that we fully support Representative Randolph in his attempt to make it easier for citizens to serve notice of appeals for decisions of Board of Commissioners, because we do fully recognize that it is challenging the way the law is currently written. Our opposition today is strictly technical in nature. Our opposition, we did not catch the bill on the House side until after it was passed out of committee. We suggested alternative language to Representative Randolph before it went to the House floor. However, our suggested fix has not been incorporated. However, with that said, we all know words have meaning. We have found the words being proposed in this bill to exist in statute. We have not found the words being proposed in this bill to exist in statute or reality. You will not find a county administrator, a county executive, or a registered agent in any county in South Dakota. These positions simply do not exist. In my previous role, I served as the commission manager for Pennington County for the past 15 years. In Minnehaha County, they have an administrative officer. In Hughes County, they have the only county manager in the state. Some smaller counties, they have commission assistants. So as you can see, the words being used have meaning, and for this technical reason, we respectfully request that you oppose this bill as currently proposed. So thank you, and I would be happy to stand by any questions that you may have.
Thank you. Further opponent testimony? Opponent testimony on House Bill 1320. Seeing none, we'll go to council questions. Committee questions.
Question.
Senator Duhamel.
Thank you, Mr. Chairman. A question of Holly Hennies, please. Thank you for joining us today. What is your fix that you suggest?
If you'd go ahead and read it yourself.
Mr. Chair, Holly Hennies, Deputy Director for the South Dakota Association of County Commissioners. Our fix, what we would suggest, would be to add in language that would say, to strike out executive, to strike out administrator, and simply say, or other such person appointed by the board pursuant to resolution to accept such notice. That way you are fully covering any such position that the board would designate, no matter who it might be.
Follow up?
Go ahead.
So you're getting rid of all the underlined area and putting that new stuff in, or you're putting in treasurer as well?
Mr. Chair? Senator Duhamel, we don't have any opposition to keeping the treasurer in. We fully recognize and understand Representative Randolph's intent with that.
Thank you. Further questions? Yeah, Senator Smith.
I would like to, I guess, ask the prime sponsor. Thank you, Mr. Chair. Thank you for coming up. Would that be those suggestions that were just made by the prior speaker? Is that something that we could work on to get it usable, since they're the ones that have to use the language of this bill? Would you be open to an amendment from this body on your bill?
Thank you, Mr. Chair.
Go ahead.
Representative Tony Randolph, District 35. I would, actually, because the point is to actually make this easier. Now, I would point out Meade County actually has a county executive director listed on their website. So it does exist. So I guess as far as the bill is concerned, maybe, I don't know if I'd like to get rid of the executive portion, because it does exist. And I think counties have the ability to create that if they don't have it. But as far as like any other, here's what I don't want to do. I don't want to simply leave it to the commission to say to do or not to do. I want to make this easy in statute for our citizens to be able to do this. And so the language that she was talking about, I don't want to strike executive, but I would add the other. I would be good with that, if that makes sense.
Thank you, Mr. Chair.
Go ahead.
I don't know if it's appropriate to talk amongst us at this time, or do I have to ask questions right now? Discussion's not.
I think we stick with questions.
Okay, thank you.
Yeah. Further questions?
Yeah, good question.
Go ahead, Senator Duhamel.
Thank you, Mr. Chair. Question of Holly Hennies again. Thank you again. So of these administrator, executive, registered agent, when you say they don't exist, in one or two counties might out of 66, but you're saying they're not defined in statute, so that's why they don't exist? Or what do you mean when you say don't exist?
Mr. Chair. In essence, yes, Senator Duhamel. Any county can create any position title that they so choose. And I apologize, Representative Randolph is correct. I misspoke that Pennington or Meade County's position is called executive director. So as you can see, there are a multitude of different position titles across the state. They all call them something just a little bit different. But to reference a specific position title in statute is what I was trying to get across, is that to reference it specifically in statute is what we wanted to avoid, so that we don't have any unintended consequences for our citizens. Because I have seen where cases can get dismissed on a technicality because they weren't served properly. And that's what we want to avoid for our citizens, so.
Thank you. Further questions? No more questions. We'll move on to discussion and/or action.
Mr. Chair?
Go ahead, Senator Smith.
In discussion, I guess this committee's been open to this in the past, and it seems like we're really, really close here, and I think the intent is the same from both parties. I think the counties understand what the representative's trying to do, and I think the representative understands that. I also hate, though, making amendments by us and trying to do that wordplay. We have in the past in this body here decided not to take action today in order to get the parties involved the amendment that they would like to see on a bill and get it right. I'm not sure if that would be appropriate for this, but I would recommend that we consider doing that, because I think we could get a win-win here fairly easily.
Thank you, Senator. Further discussion?
Mr. Chair.
But Senator Whip.
This is sort of a question of the group, especially we have a resident attorney. So wouldn't it be easiest, so corporations, they have, an address for service of process. So if you want to serve something, you don't like something the company does, here's the address you serve. Why don't we just say the county courthouse is the address for service of process instead of making it about the individual? Are we required to serve these individuals that made this decision, or can't you just, it literally be the sheriff walking it probably up one floor at the county courthouse and handing it to another party, and that's considered good service? Isn't that truly the easiest thing?
Well, I will say I don't think we can put our LRC analyst on the spot with that.
I was looking at Helene. I'm sorry, Senator Duhamel. Because I'm using words that are above my pay grade here.
I'll refer it to an attorney, Eric Erickson here, who's probably dealt with this. So if you'd want to come up and answer the question.
Good morning, Mr. Chair, members of the committee. Eric Erickson with the County Commissioners Association. So when putting the private side on that you were discussing about your private type of businesses, so in my regular job, when I'm not out here with all of you, I'm a business attorney. And for a number of my clients, I serve as their registered agent, or if someone were to call me and say, hey, what's this registered agent thing I have to do? The big thing we want is to identify someone that's going to take care of that paperwork. So it's not so much an address as it is a person. And that's where, with Ms. Hennings, had recommended an auditor, because they're, and she'd know the statute off the top of her head, but there's a statute that describes the auditor as the clerk for the county commission. So they're kind of that natural conduit. We also, in our language, had called out such other person as appointed by the resolution of the board. And the reason we did that is some of them do have folks that kind of help administer things, like Holly had done for Pennington. Brookings has a person like this, but those titles vary. And where we got cautious with putting those titles in this statute is they're not otherwise referenced. The rest of them are appointed to find offices within statute. So big reason we want to do, if you think back of why we have registered agents, why we have these things, is make sure it gets to the right person so that the process can follow. And it's one that honestly, we don't get very concerned about like conflict of interest on that, because if you think again of me being registered agent for XYZ Corp, I'm ethically and otherwise bound to represent them. So I have a bias and I'm required to have a bias, but we also need to follow the process. So I don't think you run into those issues with the auditor if you had the state's attorneys or those folks. But we do agree with the idea of let's figure out an easier path so we don't have to call a commissioner in to handle this stuff. Hopefully that answered the question.
Thank you. I'm just going to make sure that Senator. Okay, come on up, Senator or Representative.
Thank you, Mr. Chair. Representative Tony Randolph, District 35. The courthouse is where you basically start your legwork. So that's where you file. In order to appeal a ruling of a county commission, it has to go to circuit court. So all of that paperwork is done there, stamped, so forth and so on, and then you serve it. So that's why the courthouse wouldn't be a good place as far as that's concerned. Does that make sense?
So having it all happen in the same building is that sounds super easy to me, but again, I've never been in this process. So.
Mr. Chair. Well, I can. This kind of actually came out from kind of a personal circumstance, but had to do with our church, and a ruling that we disagreed with was part of that process, and so I learned a lot, and I learned how difficult it was to actually go through the process. And so that's kind of where I got the idea to bring this, was to try and make the steps easier, because there are lots of people out there that want to serve it themselves, or they can take it to the sheriff for a fee, but they want to for themselves. But I did find out, like you say, you appeal to the circuit court, but you have to do all of your paperwork through the court. And I think by making the court the place where you serve, they don't really have a direct connection with the county commission or necessarily the local governments. So.
Thank you. So discussion of Senator Smith's idea. Back in my day as mayor, I was served several times. Not personally, but as mayor, and they did have that one person to go to. So I think having the person to go to is important. But I get worried that if we get a title in here that actually isn't available or doesn't work, they're going to be chasing that. They're going to be chasing that because they don't know what it means. So are you okay with deferment, Representative? And then okay, so let's go ahead, unless there's an objection, to defer House Bill 1320. And I think it'll be next Wednesday. I don't know if we're having a meeting on Monday. So you have time to work it out. Any objections?
You looking for a motion then, or?
I can do it as chair. Yeah. I just want to make sure there's no objection. So we'll defer House Bill 1320 to next Wednesday. With that, anything else for the good of the order? Oh. And I might entertain a motion to adjourn.
So moved.
Have a motion made by Senator Whip, seconded by Senator Duhamel to adjourn. All those in favor will say aye. We are adjourned.
SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota legislature and in-depth reporting from Pierre. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB.